So my name is Professor Owen Judd. I'm consultant surgeon at the Royal Derby Hospital in Derby in the UK in the Midlands and Professor of Balance Medicine. So why did I decide to become a doctor? Well, I've always been interested in science and how the body works, particularly as a child, and always had a desire to help people. So that was my real reason to become a doctor. And I've wanted to be a doctor ever since I was a very young child, as far as I can remember. So what made me choose my specialty was really that I was always fascinated by the five senses, and three of these five senses, of course, are looked after by ear, nose and throat. They're namely hearing, smell and taste. As a medical student, my favourite area was the central nervous system, so the brain and the nerves that supply the head and neck, which we call the cranial nerves, and that was my real area of interest. And as these nerves supply the whole of the head and neck, and includes the nerves of hearing, smell and taste, that just naturally became the area I was interested in, and hence I found myself in that specialty. So the most rewarding part of my job is really the diversity of all the conditions that can affect the ear, nose and throat. It's a very good mix of both medical and surgical conditions, and unlike some surgical specialties, we don't really have a sister medical specialty. So for example, like neurosurgery has neurology and orthopedics has rheumatology, general surgery has gastroenterology. There isn't really a medical sister specialty for ENT as such. And so what I really enjoy is being both a physician, looking after the medical side of the condition, and the surgeon looking after the surgical side. It's very diverse in age as well. So we see patients right from tiny newborns and premature babies right through to the elderly. And the surgery is extremely diverse, so it can involve tiny microscopic surgery on very small parts of the body, such as the tiny bones of the inner and of the middle ear, right through to taking half of someone's head and neck off for cancer and reconstructing it. So it's very diverse specialty, and that's what I particularly enjoy about it. So the challenges of that specialisation is that some patients do present with extremely unusual and odd symptoms, and it can be a bit of an intellectual challenge in order to be able to diagnose those patients with some of these really strange presenting complaints and interesting symptoms. But I really enjoy a challenge, and that's really why I've come into this area, and particularly balance medicine especially is a very challenging area because it's a really unusual way in which case some patients do present with their symptoms. Yeah, my main catchphrase is that mental health and physical health are one in the same. So the human body is made up of both physical and non-physical elements, and any of these can go wrong, and we should all be thought of, it should all be thought of as one human being, and then therefore the mental health disorders should be treated with equal importance of the physical disorders. And in fact, as we all know, mental health problems can often present with physical symptoms, which is certainly the case with a lot of patients that I see. And therefore, it's very important to weigh up both sides of the coin and to treat everything equally.